It's time for another GI focus on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Tina Nunziato, and with me is the beautiful Dr. Liz Cruz.
Thank you.
Welcome, Dr. Cruz, to
Thank
your show.
you. Thank you.
So for those of you that are regular listeners, thank you so much for joining us. And if this is the first time you're listening to this podcast, welcome, welcome, welcome. Every once in a while, we do these GI focuses where I ask Dr. Cruz questions about a specific medical issue or a diagnosis, and then we kind of just break it down and help people understand it a little bit better in non-doctor speak.
Yes, yes.
So I asked Dr. Cruz a bunch of questions, and she answers them. So we're going to start.
Should I take off my cap?
Actually, no. This is a perfect podcast for you to have your cap on post-procedure, because for this GI focus, we're going to be talking about microscopic colitis. Yes, we had a patient actually email in and ask us to talk about this topic. So
Awesome.
I looked back because
Awesome.
we've done so many GI focuses. If you go back and look at we've got over 400 podcasts out there. We have lots of GI focuses on all different medical issues, specifically digestive things. But I looked back and we hadn't done one on microscopic colitis. So Shocking, I know.
Yeah.
So I thought this would be a good opportunity.
After all these
to do it.
years.
So the first question I always ask Dr. Cruz is, what is microscopic colitis?
Great question.
Thank you.
So basically, it's inflammation in the colon. It's considered to be more of an immune-mediated type of reaction, like an autoimmune type reaction. But to be honest, there's still a lot to be discovered about microscopic colitis. It's not fully understood, but it is an inflammation. It's a type of inflammation in the colon that typically is made by looking at the tissue of the colon. So for the most part, when you look in the colon, it's not like you're looking at the colon and you're like, oh, this person has microscopic colitis. Most patients that have microscopic colitis, most of them, their colon will look normal for the most part. The way the diagnosis is made is by actually taking biopsies, getting tissue of the colon to send to the pathologist. So it's a pathologic diagnosis.
You're already jumping forward, Dr.
Oh,
Cruz.
I am? Oh, I'm
into
sorry.
how we diagnose
I'm just so
microscopic
excited.
colitis. So stop right there, okay? The next question I want to ask you is, people probably know about IBD, like irritable bowel disease, colitis, and Crohn's.
Wait. Okay.
So how is microscopic colitis different than, let's say, regular colitis?
Okay, so first of all, IBS, irritable bowel syndrome, is typically a combination of abdominal pain associated with altered bowel movements, okay, for the most part. Now, in someone with microscopic colitis, for the most part, the main symptom usually is diarrhea, though some people will have some abdominal discomfort. But let me stop again before I get too far. IBS, irritable bowel syndrome, again, usually more of a combination of abdominal pain, either with diarrhea or with constipation or with a mix.
I did say IBD, didn't I?
You said, but then you said irritable bowel syndrome.
Oh,
yeah.
No, I think I said
Whereas
irritable bowel
IBD is
disease.
inflammatory bowel disease.
Okay.
Yeah, inflammatory bowel disease is the umbrella term for ulcerative colitis and Crohn's disease, just to keep it simple, okay? Ulcerative colitis and Crohn's disease, usually when you go into the intestine, into the colon, you're going to see abnormalities. You're going to see inflammation, redness, or you may see ulcers. I mean, you're definitely going to see inflammation. You're going to see changes, as opposed to in microscopic colitis, where, like I mentioned earlier, you're not going to actually see anything. For the most part, a normal looking colon.
So the next question is how you diagnose it, which you mentioned. It has to be diagnosed with a colonoscopy, with taking biopsies.
With taking biopsies.
There's no other way to diagnose microscopic colitis?
No, you could do a short exam, like a flexible sigmoidoscopy, but which only goes up, part way in the colon. But the real the real gold standard would be to do a full colonoscopy, so that when you get in there, let's say the person's having diarrhea, their colon looks normal, then you typically will take biopsies from the right side of the colon and the left side of the colon. It's a pretty patchy disease, so you want to definitely get a random sampling throughout the colon, because it may be in one piece of tissue where you may diagnose it based on that, and on the other tissue there may not be any evidence of microscopic colitis.
So it can be in any part of the colon.
Exactly.
And what are the symptoms that people usually present with if they have microscopic colitis?
Typically diarrhea. The majority is going to be, the symptom is going to be diarrhea. Sometimes they may have some abdominal discomfort. They may have some urgency or incontinence just from having the diarrhea, but in general, the main symptom is diarrhea.
Okay. And once we diagnose it, the pathology comes back, says microscopic colitis. What is the traditional medicine routine for the next step for that patient?
So typically, and I do want to just mention really quick, I want to back up, microscopic colitis is an umbrella term also, which encompasses, you have collagenous colitis, and then you have lymphocytic colitis, and those are typically the ones that will be reported out when the pathologist reports a diagnosis of microscopic colitis, and they'll describe, about their findings and say this is consistent with collagenous colitis or lymphocytic colitis. Those are microscopic colitis. Okay, so those fall under the umbrella of what microscopic colitis is. As far as treatment goes, sometimes it could be as simple as having the patient stop using a certain medicine that could be causing it, because there are certain medicines that have been found or discovered that could cause microscopic colitis. And some of the most common medicines that we use, like the NSAIDs. Okay, the NSAIDs are the non-steroidal anti-inflammatory medicines like Motrin, Advil, ibuprofen, Aleve. There's a whole list of NSAIDs. Well, NSAIDs can cause microscopic colitis.
And a lot of people are popping those.
A lot of people are popping
like
those.
Like candy every day.
Absolutely. Yeah. I mean, you can buy them over the counter. So other medicines that can also cause microscopic colitis are PPIs, which are the proton pump inhibitors like omeprazole, Prilosec, pantoprazole, Nexium, just to name a few of them. So that's another one. There are certain antidepressant medicines that can also cause microscopic colitis. Certain statins, which are like cholesterol medicines. So sometimes it may be as simple as having the patient stop a medicine that could potentially be the cause of the microscopic colitis. The unfortunate thing is that we never know for sure, right? It's not like when we get the diagnosis from the pathologist that the pathologist can tell us this is being caused by this medicine. Okay, so we just always have to be looking at what medicines that person may be on. The next would be putting them on antidiarrheals. So a medicine that basically helps to slow down the diarrhea. Medicines that can be purchased over the counter, like Imodium. There's another one called Lomotil, which has to actually be prescribed. But those are examples of antidiarrheal medicines that we can use to try to slow down the diarrhea in somebody with microscopic colitis. And sometimes just putting them on an antidiarrheal, making sure that they're not on a medicine that could be causing it, will do the trick. Sometimes that's not enough and they need something a little stronger, like a steroid. Usually, for the most part, if it's a patient that needs something stronger like a steroid, there's a steroid that we use in treating microscopic colitis called budesonide. That's one that we commonly use if this person has not responded to the antidiarrheals. We'll put him on budesonide, and for the most part, most of these patients typically will respond to that and start to get better, and then usually we're able to wean them off of that steroid till we get them off of it, and most of the time they go into remission. I have had patients who we've struggled with diarrhea for like over a year or 2 years, where, it's been a struggle trying to get them under control. Other things that help too is diet. Making sure that they're not drinking alcohol, making sure that they're not drinking any caffeinated beverages, getting them off dairy. I mean, these are like simple things that can be done dietary wise, but that could make a huge difference. Another big thing, those of you that have been following us know that we are huge fans of probiotics. Probiotics are so important, and that's something that highly recommend for anyone with microscopic colitis. I mean, in general, for everybody, but especially if it's somebody that's struggling with ongoing diarrhea because of the microscopic colitis. So their diet, getting them on probiotics, getting them off of medicines that could be causing the microscopic colitis, and then sometimes using some of these other medicines to treat them.
So you jumped again into the more natural approaches, which is fine. Okay, so she covered the more natural approaches, so that's great. Any of the testing from the more natural standpoint that we offer that you think might be helpful with microscopic colitis?
Absolutely. Getting tested for food sensitivities is a big one, because we are seeing a lot of food sensitivities, and because we really don't understand the full cause, we don't have a full understanding of why people develop microscopic colitis. I mean, it's thought to be an immune issue, autoimmune, which, by the way, brings up the point that these patients need to be tested for celiac disease, because there is definitely an association of microscopic colitis with celiac disease, also with like psoriasis. So definitely we will test these patients for celiac disease, but on a more holistic platform, getting tested for food sensitivities, so important, because there could be some food in there that you are sensitive to, that you're not even aware that you're sensitive to, that could be triggering your immune system to kind of go crazy in your intestine, and could causing some of this inflammation.
So you mentioned that the microscopic colitis can be healed or reversed if you get off of medicines, or maybe do some more holistic things. Does that mean it completely goes away eventually, or
that's a great question?
That can be healed, quote unquote.
Yeah, great question. I've had patients who have had microscopic colitis, and years later we're seeing them, and they've never had a recurrence. Okay. And once they got treated and got better, and we were able to take them off their medicines, they've been fine. By the same token, I've also had patients who have had about a microscopic colitis who maybe years down the road end up getting another bout of it. So whether they're predisposed now to having more episodes of it, I don't think we know that for 100% sure if that now serves as a risk factor, though I would say that if you've had it once,
you're more likely
it's more likely that you can have it again.
Right.
I think it would depend on a lot of things, your diet, medicines that you're taking, your stress level.
But it can go away.
Yes, absolutely. Absolutely. It's one of those diseases, I don't even like to call it a disease, but it's one of those diseases that definitely could have a very good outcome. The person could go into remission and do great.
Excellent.
Yeah.
All right. Anything else?
And not have to stay on the medicines.
Right. That's the most important
Yeah.
part. Anything else you want to share about microscopic colitis that you think would be important for everyone to know?
I think that if you are having diarrhea, you definitely want to get it checked out. Okay, there are a lot of different causes for diarrhea. When patients come into our office for diarrhea, typically we will check stool studies, rule out an infection, get some celiac serology or blood work, make sure we're not dealing with celiac disease. And, and probably end up doing a colonoscopy on this person. But I think the good news is that it is treatable. It's something that you can go into remission and potentially never have an issue with it again. However, I do want to make a point, and Tina and I talk about this all the time on podcasts, is there are medicines that anyone can go out and buy over the counter. Okay, for example, the NSAIDs. Okay, the non-steroidal anti-inflammatory medicines. People take these medicines like candy. Okay, they don't understand that, yes, they're used for, whatever, pain or whatever it is that you're using it for. However, there can also be side effects and adverse reactions, adverse things that can happen with using these medicines. And so, for example, microscopic colitis, with that can be associated with the NSAIDs and the PPIs. I mean, you just have to keep in mind that any of these medicines that you take are chemicals, and they may be helping one thing, but because they are chemicals, there could be adverse side effects, and you just have to always keep that in mind. So if you don't have to be taking NSAIDs, don't take NSAIDs.
Yeah, we just talked about too, like stomach ulcers.
Absolutely.
From NSAIDs
Absolutely.
as well. Yeah. All right. Well, thank you so much, Dr. Cruz, for enlightening us on microscopic colitis. We would love to connect with you. The best way to do that is by signing up for one of our free 30-minute phone wellness consults. You can do that by going to our website at drlizcruz.com. There is a magenta-colored button that you can click on to schedule your free consult. And if you have not subscribed to our show, please subscribe so that you never miss an episode. And go out there and please, please, please give us a 5-star so that other people just like you can find us. So thank you so much for joining us, and we'll catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.